Hi, this is Brian Wormers recording a brief overview of the change paper. So within management, leadership, and professional issues, you have to write a change paper. And when you go into coursework, you will see that you've got a change paper directions form as well as a rubric. So I'm just going to go over those briefly with you so you have an understanding of what needs to be done for this paper. So first and foremost, observe your clinical environment. You guys are in a great position as students. Take a look around and see different environments and compare and contrast things. What do you see that's wrong? What would you like to change? What's something that's maybe more efficient or safer for patient care or any of those issues? So look for those signs and symptoms and then look at that nursing process in place. How efficient are they? Look at infection control things. Although I do not want you guys to do like hand washing or some of those main staples or VAP bundles, any of that stuff that's kind of been done to death. Look around, find something else that you can write on. So, and then anything can really be a catalyst for change. It could be anything from, nursing safety to nursing happiness to patient outcomes. Any of that stuff is fair game. So within that, then you're going to diagnose that problem, and then you're going to pick a change theory. So Lewin's is one of those that you can widely use. Otherwise, there's lots of different ones, and you can see that in the other PowerPoint. Then put a plan together. Use that change theory and write it out. What are the steps that you're going to take with this one? It should include all those activities about how you're going to bring about that change, as well as an evaluation tool to measure that, which you're going to have to come up with. And then the way to make that change permanent and keep that around. You do have to include a timeline in your appendix of your paper that needs to be appropriate. You cannot say, well, on Monday we're starting it, on Tuesday everybody else is going to follow it. It doesn't quite work that way in a hospital setting or in most work environments. You need to do your legwork on it. You need to do some research on it. It's going to take time to do that. How are you going to roll it out? In which manner are you going to roll it out? Is there going to be a training video? Is it going to be a PowerPoint? Is it going to be an active presentation by you? Is it going to be on YouTube? Is it going to be on a flyer on the back of the door in the bathroom? All those things are different modalities I've seen used. Which one do you want to use? And then with that timeline, like I said, it's got to be realistic. Some of the stuff can't get rolled out for 3 months down the road, and it'll take another 6 months to, fully get in place and become operational. And then at the end of that, you're going to have to do something to evaluate that. So I do want you to come up with an evaluation tool for that, and also put that in your appendix. So you need to, for this paper, it's going to be, your title page. You do not need to have a particular abstract in your paper, and in fact, I'd prefer that you wouldn't. Do you have a nice intro for it? Lay out the problem for me so I can understand it. And then go into the meat of this, and why is this an issue? Why is this something that you need to change? And then fully explain how you're going to do it. Pick your change theory and use that and write that out in the full development of this and how that's going to work for you. So down here it does say it's got to be an APA format, appropriate title, reference page. Does not need to have that abstract, however. But then that appendix, and in that appendix you're going to have a good timeline as well as that evaluation tool. So this should not be all pages considered greater than 8 pages. So you need to be a little succinct with this and writing this. So how am I going to grade this? So basically, looking at the rubric, you got to have a good topic choice. Something that's interesting, something, like I said, if you do hand washing or the VAP bundle or something that's kind of been beat to death, you might lose points because it's not really current nursing. It's something we were expected to be doing by now. If you're not, then I suppose, get that floor up to speed, but I don't want to see it in the paper. You got to back it. Why are we doing it? Why do you want to change? Why do you want to do this with evidence-based practice? Then use statistics. What are the current rates? What are suspected rates in the future? What do you think the impact of healthcare will be on either the patients or the nursing staff? And then, really try to implement lots of different resources and support your points. Content-wise, so I want you to have lots of different elements to this. It's got to be current, it's got to be accurate, it's got to be appropriate. You got to have a change theory and use it appropriately. You have to have a comprehensive plan, and then include a good timeline, like I said before, and then a method of evaluation as present in the addendum. I do want this to be a well-organized paper. You know, it's got to flow in a logical and interesting way, something that's easy for me to follow. You can't be jumping from here to there without any reason or rhyme to it. And then analysis. So how are you going to run diagnostics on this to see whether it was appropriate, to see whether it was successful? And that's where that implementation tool is going to come in. And then how are you going to implement it? You know, is it going to be a doodle poll? Is it going to be a SurveyMonkey? Is it going to be a hard copy? Is it going to be something where you just randomly poll nurses on the floor? Think about how you're going to run your analysis on this. And then, of course, formatting. It's got to be in the APA format like we already talked about. Make sure it's clean, no misspellings. Work on your grammatical errors. So, in summation, that is the change paper. That is the things that I want you to do. These are the things I'm going to be looking for. And if you have any questions on this, by all means, please contact me, as I'm very willing to help you out with this. All right, thank you.